Hi, nice to meet you all. My name is Dr. Ragavan. I'm a Uro-Oncologist. I'm a specialist in urological cancers. The next topic that we are going to talk today is about penile and testicular cancers. Penile and testicular cancers form part of uro-oncology spectrum as a part of urological cancers. Penile cancer arises from the male organ. Interestingly, it is a cancer of old men, occurring mostly at the age of 60 and beyond, many times at the age of 75 and beyond. And it is sadly the most easily detectable cancer which inevitably presents so late. And the only reason that it happens is because of the inhibition of the patient. The patient can easily feel that there is a lump, but they tend to ignore it. They don't want to discuss it. They don't want to talk with their friends or the doctors about it. And they keep thinking it will go away. But sadly, with time, it grows and becomes, or it comes out to be cancer. So the take-home message is that if you have a lump in your penis, do not hesitate to consult your local doctor and take appropriate measures or treatment for the same. The cancers in the penis is called squamous cell cancers. Very rarely other types of cancers do happen. The majority of the cancers arise from something called glans penis, and the treatment for that, the diagnosis for that is made using a biopsy. Once you have done a biopsy and proven that it is cancer, we inevitably do some other staging test, which includes a CT scan, examination, and if necessary, FNAC of the lymph nodes. With the information in hand, we then take a call. Can we remove just the tumor? Does it require removal of the tumor and the organ as well? If the tumor has gone to the lymph nodes, do we need to remove the lymph nodes as well? And if the tumor has gone deeper in, does the patient needs chemotherapy? So these are the things that will be discussed by your doctor, and the treatment is given effectively. The good news is that if you have penile cancer picked up early, we can do something called organ conserving surgery. That is, you remove just the tumor and leave the rest of the things in place so that the function of the penis continues to be there. Even though it happens in elderly population, the best way to diagnose is awareness. Just be sure that any lump needs a doctor consultation. The next thing I'm going to talk about is testicular cancers. While penile cancer is in one spectrum happening in elderly population, testicular cancer happens in the younger population, age group 20 to 40. What is the key of diagnosing testicular cancer is awareness, awareness, and awareness. All men should do testicular self-examination, like women who are always encouraged to do breast self-examination. All men should do testicular self-examination. In medical terms, we call TSE. How often you should do? You should do once in 3 months in the shower. And if you notice any lumpiness in the testicle, you need to consult your local doctor. Testicular cancer happens in younger population. The good thing about testicular cancer is that with the advent of modern treatment, especially the modern chemotherapy, we are achieving cure even in the most advanced stage of the disease in as high as 60%. So, which means that the majority of the patients who get testicular cancer can potentially be cured. Once you feel that there is a lump in the testis, you immediately consult your doctor, who will order for a scan, ultrasound scan of the scrotum, and if that diagnosis as cancer, then the doctor will advise removal of the whole testis or part of it. You please go along with the doctor, and I'm sure they will give you the adequate explanations for the same. After that is done, depending upon the location and spread of the cancer, further treatment such as chemotherapy will be planned. If it is a localized cancer not spread elsewhere, you may get a single dose chemotherapy. In patients who have advanced cancer, they may get 4 cycles chemotherapy. Extremely rarely, those patients who have advanced cancer after chemotherapy, they may require a completion surgery in the tummy called RPLND as well. but thankfully that happens in a small numbers. Okay, once diagnosed and treated, make sure you're on a strict follow-up. Make sure you visit the doctor every 6 weeks, 8 weeks initially, and then it can slowly uh, expand to 3 months and 6 months. But important is to visit doctors and do all the blood tests and the scan that is to be done at that appropriate time. Testicular cancer happens in young men, and therefore there is other problem which comes with it, that is fertility. Because after testicular cancer, if the men require chemotherapy, that can have an adverse effect on the fertility. So patients who get diagnosed with testicular cancer and who is to undergo removal of the testicle, we tend to advise them to store the sperms in a sperm bank before you undergo the chemotherapy or the treatment itself. It is very easy to do that, and majority of the sperm banks now store sperms for at least 5 to 10 years, which will come to help us in future when it comes to fertility issues. So awareness is the key. Self-examination is the most important component of it. Do not hesitate to consult the doctor. Don't think your lumps will go away. A lump in the testis means examination and scan, and if diagnosed and treated early, you can be cured. Have a good day.